A great question is, are there any benefits to doing one eye at a time? And we had covered in a previous video about why doing both eyes at the same time is largely a benefit to the patient in neuroadaptation, as well as the convenience of just coming for one time to the operating room, one set of anesthetics, and then one set of instructions and follow-ups afterwards. So it really halves the time commitment from the patient, but as well as from the clinic as well. So doing one at a time is for ROE just doesn't make sense. For cataract surgery, it's a tradition because you're at the mercy of insurance. Insurance will only pay for one eye at a time unless you have Kaiser insurance, in which case they do both eyes at the same time because they're their own payer. But insurance companies, for incentivized by, more just dollars and cents, will just do one at a time, wait, a month or so in between, and then do the other eye. They, of course, don't pay for they don't reimburse the facility or the doctor for the second eye to the fullest extent. I think they pay, probably half or less. So it disincentivizes almost all doctors who use insurance to do both eyes at the same time, even though it's safer, even though, it's a better experience for the patient. So advantages to doing one at a time, if we were asked about 10 years ago or even 20 years ago, we would say there's an advantage, and it's to look at the results from the first eye. We had mentioned that we could be off target, that the predicted lens for the eye can we can have a residual refraction or be off target. And then in the past, when the biometry and the machines that perform the biometry weren't very good, that was more likely to occur. And so you would then possibly take that into account when you approach the second eye, and based on how much you are off target in the first eye, you can take that into consideration for the second eye. But biometry is just so darn good now at predicting the intraocular lens that we're less than about 4%, much less than 4% off target, rate of being off target or having a significant residual refraction, that it just doesn't make sense not to do both at the same time. That's not to say it's foolproof if you did one eye, had a off target, and then you were going to be on target, taking that extra information into account. No, there's so many other factors, how the biometry is performed, who did the who did the measurements. In my practice, the other doctor does all the measurements, Dr. Ebel, and at any other practice, it's probably not a doctor doing the measurements. It's could be someone random. You don't know, it might be their first week on the job. But anyways, we have much more experience on our teams. We have the best biometers, the Argos or the IO Master, that it just makes no sense for that to be the reason that you do one eye at a time. Other reasons, well, we had gone over why bilateral surgeries are safer, less risk of infection than doing one eye at a time. It doesn't make sense, right? But I think nobody really knows why, but if I were to guess, it's because bilateral surgeries are offered at centers that just offer eye surgery. They have the training, the experience of only eye surgery, the protocols and sterility of a proper eye OR, that we never see infections. None of my ORs have ever seen an infection. The opposite side of that is you go to like the hospital or ASC setting, and they're doing colonoscopies or other procedures in between eye surgeries or in between days of eye surgeries, that people are doing all sorts of things, wearing all sorts of different hats, that it probably isn't as specialized as if the surgical center such as ours that just does eye surgeries, and every criteria is eye surgery and sterility and Eyes are very different from skin and general surgery, obviously. So there is a difference. But beyond that, none of us know why the data suggests that same-day bilateral surgeries sees less infection risks, just better outcomes in general. Most European places do it that way. So other reasons why you would do one eye at a time. There's a good reason to do one eye at a time, and this is the only reason I can think of, and that's if you have an extremely dense cataract. The reason, like we said before, is when you have a dense cataract, the healing process is long. It is as long as however dense your cataract is, or however severe your cataract is. When we go to use energy to break up that solid rock-like cataract, it's a lot of energy, and that's going to make your cornea and your vision foggy after surgery. So if you do both eyes at the same time, assuming you have the same density of cataracts, you're going to be foggy in both eyes simultaneously, and that's obviously going to be a bit of a risk to you because you're not seeing well in either of your eyes. So it might then make sense to do one eye, keep the other eye as is, something you're familiar with, that you've worked with before. Wear your glasses, obviously, pop out the lens on the other side that we just did, wait for that eye to heal before you approach the other eye. That makes a lot of sense, and that is out of abundance of safety. That should be the way to go. But that makes no sense for RLE with clear lenses or, baby cataracts. It makes no sense at all. So just to summarize, I see no reason other than you have just proper dense, third world country kind of, cataracts that you would do one at a time. You just let your cataracts go for like an extra 20 years, and held off on doing the surgery. That's probably the only time I think it's, I would recommend for you to do one eye and then wait until that eye sees well to do the other eye. Now, you also have to keep in mind that I've done a lot of cataract surgeries based on insurance, one eye at a time. We plan on doing a multifocal lens. The patient gets a multifocal lens in one eye, and it doesn't match, right? They're off balance, and they can't neuroadapt. They try to convince themselves that this was the right choice, this multifocal lens, but somehow the brain just isn't getting used to it. Well, it's because the other eye isn't done. A lot of these patients talk themselves out of doing the other eye completely and try for a different lens. But gosh, if only you knew how happy bilateral patients are almost the day after surgery, because it's that imbalance that just has a really hard time for your brain to understand how your vision now works. Think of it this way: you have a multifocal lens. This is one way of seeing everything all at once. There's going to be a bit of adjustment to using this lens, and then the other eye is trying to accommodate to match this other lens, but you may have a prescription in the other eye, and so it just doesn't work. They're two completely different systems. It's like taking my Tesla and putting a gas engine somewhere in my Tesla and expecting it to be, functional, but no, it's just, they're two different systems. You cannot mix them. So just speaking from experience, it is always a struggle for a patient having just done one eye advanced technology lens, waiting for the other eye. Nobody ever does well that way. And take it from me, if you were convinced that by your eye surgeon that you can have RLE in just one eye and expect to read and see everything all at once while leaving the other eye alone, I say keep dreaming. That does not work. We have seen that many, many times, and cataract surgery has taught us that just doesn't work. When you do one eye, you almost have to handhold, to a greater extent to get the patient to do the other eye so that the patient can ultimately be happy, because they're not gonna, this 1 month in between the two eyes is just a very, very stressful and very unhappy spot for everybody. So my suggestion, two eyes at the same time. I don't accept insurance in any of my facilities. So it's kind of a non-issue for us, but we still get patients who ask us, I would like to do one eye at a time. And I say, it's really not a good idea. If the goal is to do both eyes, do both eyes at the same time. Anyway, sorry for the long discussion. That was a question that came up at least twice in the last week, so I thought I'd make a video. It supplements the video where we talked about the safety of doing both eyes on the same day. Okay, thank you.